So next up is questions and discussion. So we have some time here because the workshop ends at 1:30 today. We're going to open it up for some questions and discussion. Thank you, Aurora, for all of your training. And we're going to welcome Shantala Hanya to moderate our discussion here. She's an IP with CDP HHII program. We're excited she's here today. And so, yeah, if you have any questions, feel free to put them in the chat and or unmute, and we'll call on you. Take it away, Shantala.
Thank you, Sophie. Thank you, Aurora, for a great presentation. Every day we learn something new, right? So there's a couple of comments, and then I will start with the questions, Aurora. One of the comment was EVS managers always rely upon IPs for product selection. Yes, that is always a good idea. It's a teamwork, team effort. IPs knows, your infection preventionist knows what's happening in the building regarding what kind of organisms or the germs are in your building. So that will help the EVS managers to select the appropriate disinfectant. I think, Sophie, you already covered for the Spanish version. Apart from Spanish version, there is a lot of requests for French, Somali, Vietnamese, but we'll start with the Spanish version first, I guess. So we'll go from there. Hopefully that will be helpful. If the time permits, we will go back and review some of the questions was asked on our first two sessions for today. But with that, I will start with the first question, Aurora. This is regarding the re-wetting of a surface. What is the maximum amount of time that we can wait between the wettings? So is it sufficient to wipe a surface and then to wipe it again 8 to 16 hours later? I'm assuming that this one is, they have already attained that 10-minute contact time or a 5-minute contact time required based upon the disinfectant they have. After that, so then I'm assuming between those, right? So then is it okay to wait for 8 to 16 hours to clean the same surface? So I'm assuming that's what they're saying. With that, do you have any recommendation to do more frequent cleaning of the surface?
That is a great question. And it would depend. I mean, I want to say that you'll have a policy and procedure about the frequency of cleaning some items. And then like if you are like in an outbreak, you might want to reapply and, do more frequent cleaning. So I can think of that. I don't know if you have anything else to add, Shantala.
I think you kind of covered it based upon if you're trying to attain the required contact time within the 10-minute or a 5-minute, and if it dries off sooner, so then you have to reapply to attain that. But if you're talking about between the cleaning, it all depends upon the contamination in the room, right? So then if you wait because it's especially if it is a high-touch surfaces, your bedside table, your bedside rail, or a call button. So it's always an additional cleaning by your CNAs or the other nursing staff will help you to reduce the bioburden, right? So then it depends upon a situation what you're talking about. So if not, so then usually the EVS does the room cleaning once a day. So it'll be next day they'll be cleaning. If that did not answer your question, please come off of mute. You can clarify. The second question, go ahead.
Hello, how are you?
Go ahead.
So what I'm kind of thinking about is, I guess I didn't really clarify too well. I'm thinking kind of in common areas, like if we wipe down a hand railing and it's done like once a shift. So someone wipes down a hand railing and then the next shift, the next EVS person wipes down the hand railing. Is that sufficient, or does it need to be a wipe down and as soon as it's dry, wipe it again?
No, I think it's the, Brenton, based upon what you're saying it's the common areas, like in the common space, dining room or other areas where if they're cleaned once and if there is no gross contamination. So you'll always wait for the next shift to come, but it is up to your facility to make the decision. Okay, so how many, like, are you going to clean that common areas twice a shift? It's up to the facility. You can make the decision.
Thank you.
And I think the next question, Aurora, is regarding, is it a problem to keep a personal item such as sweater in the EVS closet during your shift? They're assuming that keeping the EVS closet, sometimes what we have seen is they don't have their own space for the EVS staff. There is no staff room. There is no cabinets or whatever there to keep their personal stuff. So we have seen that they always store it in the closet, EVS closet. Is that okay to keep the sweater or their purses? We have seen that. So is that okay to keep it?
I know we don't recommend that to keep any items in the closet. You know, you want to keep that area clean, and you know, you don't want to cross-contaminate your personal items. But it is true what Shantala is saying. I guess if you don't have a place, or you know, a break room or a locker or somewhere where you can place, I think you can bring it up to your EVS manager and the facility. Maybe they can accommodate or come up with some ideas of how to address that. Anything else you want to add, Shantala?
No, you covered it, Aurora. It's just that, yeah, it's employee exposure to the chemicals, right? So how much chemical, the disinfectant products you have it in the closet will go on those clothing, and then those staff will be wearing that, and then they go taking it it's a personal stuff, right? So you covered it. The next one, I think Nanette had a question regarding, is the spray bottle is allowed in the hallway restrooms? I know we don't recommend the spray bottle inside the patient resident room, but is it okay to use the spray bottle in the restroom, common restroom, in the staff restroom? So is it okay to use it?
I think we recommend not to, because you know, when you are spraying, that is going to spread in the air, and then some people might be sensitive to the product that you're using. For example, if they have asthma or something else. I mean, you can use like a pour bottle if possible, but this will be in the hallway. Do you have any other recommendations, Shantala, to that?
I think it's the key point what you covered, Aurora, is aerosolization of the chemical. So yes, in the room, we think in the resident room, we think about the safety of the patient, but also you have to think about the safety of your staff, right? So remember, they don't use PPE in the hallway, so they can inhale those chemicals and then the fumes, right? So it's always better to use the not to use the spray bottle. You covered it, Aurora. So the next question is, the next question I have is, you mentioned that we should not store anything on the car, personal items. So as one of the question came up was, it's hot. So can I keep the water bottle? Is that okay?
No, it's not okay. Yeah, we don't recommend any personal items on the cart. But it's also a call OSHA issue, correct, Chantala? Do you want to add to that?
Yeah, I think again, it comes back to the safety, as you said, Aurora. It's a Cal OSHA requirement is how are we keeping our employees safe, right? So one of the recommendation, I think, Aurora, they talked about it last session is, can we have a water station because it's so hot? Is it okay? Yes, we don't want to keep the a water bottle or any drinks in the nursing station either, because sometimes you have all these specimens or like, you know, it's your residents are coming to the station. We know always they're standing there, they're talking, they're touching. How many times are we cleaning that nursing station, right? So we don't know. So it's always better, like, can we keep a nursing at the nursing station? Can we have a designated area to keep water, because they don't want to go back and forth to their break room or to their car. So you can make the decision, the risk based upon the risk assessment for your facility. The second question, another question is, just to clarify, so they had to start the cleaning process from clean to dirtiest part. Is that true?
True. That is correct. You always want to start from clean to dirty.
Thank you, Aurora. So I think it's many of them, they get confused with, okay, we have seen they always start with the patient bed first, because they always, okay, this is the dirtiest, let me clean this one first and before go to the other side. But you always start from the outside to the inner side, because you don't want to cross contaminate what's on the patient bed rail to the doorknobs or the light switch. So the next question is, in our facility, they have one of the first IP said, so they have 5 bed rooms, and they also have bathrooms, which is in the back of the hallway, because we see in some of the structures, depending upon, some of them have the bathroom in the back, some as at the front. So what is the recommendation if the bathrooms are located in the back of the hallway? Sorry, back of the room.
The back of the room.
All the way in the back of the room. So I can start and then you can add, Aurora. I think it's the same process, like if as Aurora mentioned on the last session, the last presentation, where yes, you're starting from the clean area, and then when you go to the bathroom, so that becomes that is there. So then to move from there, so you can clean everything and then to the bathroom. But if you end up doing the bathroom in between, so you had to clean it again, you are removing your gloves, performing your hand hygiene. Anything which was taken to the bathroom is all cleaned before it comes back to the cart. If you're able to, she showed exactly the zoning part, right? Like how you're able to, so each places when you're going. So that will be helpful. Anything to add, Aurora?
No, thank you. You covered, but that is true. The module 4 also covers the zones. If some facilities like that approach to cleaning residence rooms, so that could be another option too.
Thank you. I think I covered that one. I think there are a few questions on the chat, and some of them are related to like if the COVID related questions. I think we are going to respond to that record of COVID-19 immunization booster for patient. Clarissa, if you can send an email to HAI program, we will respond to you for that because you are entering the information to NHSN, but we can respond to that directly for you. And the next question, I think it's a long question. I'll try to read it, Aurora, and see if we can respond to that. Kathleen says, what is the best way to hand room changes? From an IPC standpoint, the vacated room area should be cleaned just like a discharge. However, this poses a problem when a resident are swapping bed assignments due to roommate incompatibility, as there is not always a temporary location for the incoming resident to wait while room is cleaned. One suggestion I have made is to move everything with the resident, including bedside table, nightstand, landline, phone, etc. Do you have other ideas on how room swaps could be safely handled quickly? Okay, it's a long question, but I'm going to shorten it for you, Aurora. I think it's what we have seen is sometimes when the residents don't get along, right? So when they don't get along, so then they had to move them. And then sometimes situation happens where you now you have a culture report comes back positive for an MDRO. So then they had to move. So they don't have, or if there is a new patients coming in, so they don't have enough time to make room, because if there is two males in a two different room, but they want to combine together, so they're trying to instead of just moving the resident. I think Kathleen is talking about moving everything belonging to that resident to the different room. It's a very difficult question to address, because it all depends upon the facility to facility. In some facility, the EVS staff are available to assist you with the cleaning, where you just move the resident where you're working with your nursing team. You're able to do the deep cleaning quickly, rather than 2 hours. It all depends upon what you have. But even if you're swapping, Kathleen, all the equipment or your furnitures from one room to the other room, those need to be wiped, because you don't want to you don't want to contaminate the hallway. How are they transporting? So there is a lot more when it comes to that swapping. So you really need to work with the EVS staff, need to work with the nursing staff to come up with a plan. There is no one clear answer. It's a more of situation by situation. You had to, and facility to facility, you should come up with a plan for your facility. Aurora, anything to add? If I miss anything?
No, I think you covered everything, but we can bring in on the office hour as well, so we can review more further, because yeah, you have to look at all of the different aspects to that. So yeah.
Okay. So the next question from Sheila, it says, should emptying the trash be the first thing to do in cleaning the resident room? From what I remember, I learned from this workshop, cleaning should start from the cleanest to the dirtiest. So they're talking about emptying the trash, Aurora.
I think they can do that, and we covered that in one of our activities. Obviously, you have to do it and then keep it away from your body so you don't contaminate. But yeah, you can do that.
Yeah, I think we always remove your trash, right? So you don't want to have overflowing trash when you're trying to clean the room. What we have seen is always they remove the trash or any dirty linen in the room. So those needs to be removed. Any gross material needs to be cleaned up. If it's always a good idea, I think we have seen on the bedside table, we always have a lot of stuff on the bedside table. So if you can organize that before you start cleaning the room, so that helps you to improve your workflow. And then the question again is on the restroom should be cleaned last. So that is true. Restroom, we always prefer to clean the restroom last. But for some reason, as Aurora mentioned, if it is in the back, one of the questions was if it is in the back of the room and that you had to clean that one to come out to clean the rest of the room, you really need to make sure, we talked about the hand hygiene, changing your gloves and performing hand hygiene. So that's the key. The next question, Aurora, is housekeeper on a unit are using the same sponge to clean the inside of the toilet bowl. Shouldn't they be using a different sponge for each toilet bowl?
Yes, they should be using a different sponge for each toilet bowl. Do you want to add anything?
I think this question came up with the last two sessions. Aurora, remember, with the toilet bowl brush, can they leave it in the room or do they need to change it? So we will bring it back during our office hour because it all depends upon. So if you are able to use the disposable one, that's good. So to each of them, but to keep it, so that's again, so you had to work with the leadership about the cost effectiveness and work with your infection preventionist. But you also need to look at to leave it in the the resident bathroom itself. So is that feasible? Because if you have a memory care unit or if you have a dementia patient resident, that's not a good idea to keep the toilet brush in the bathroom. So it's always good to you need to assess what kind of a population you have in your building and where you can. From the regulation perspective, so it's only like we did reach out to, because this question came up during our CNA session too. So regulation wise, so you can, but it's if there is a only risk is what kind of a patient's room you have placed those the toilet brush. But we will bring it back during our office hour.
Speaking of office hours, I see there is just a few minutes to wrap up here. So I noticed there's some other questions in the chat. Thank you so much for all your questions today. And thank you, Chantal and Aurora, for answering those. We'll take note and make sure to bring them back during the office hours. So please join us for that. We'll share the link and how to register in just a moment.